single council in the country is facing the same challenge, particularly in social care. We get more customers every year, often with more complex needs, and we got less money. Our approach in Gloucestershire has been to really focus on what are the absolute needs of our customers, to try and understand a real evidence base and move away from just providing the same thing we did last year, or a bit of guesswork, or what our providers think our customers might need. For our clients with a learning disability, the big worry is actually the night time. Are they in their beds, or are they getting up many times wandering around? The phrase we use is waking nights, and it's so easy to spend over £100,000 on a package looking after those risks. So we've looked for innovation, the smart way of doing things, and we've turned to a company called Just Checking. They use a small room sensor to understand what that client is doing through the night and designing a package of support that actually meets the real needs of that customer. Now, in some cases, that's been about providing more support. In others, it's been about providing less support, perhaps even remote monitoring. On balance, we're saving money there.
We've been using Just Checking for a number of years now in Gloucestershire. We use it as an assessment tool. It helps us to monitor movement using a variety of sensors and door sensors. It enables us to see exactly what's going on in a house. It enables us to consider support to make sure that we're ensuring that people are safe and that we're still maintaining a level of independence where possible.
Most of the systems that perhaps have been used in the past would have been perhaps a camera. With the Just Checking system, that it's not a camera and it will feel less invasive, because with a camera it would be like spying on people. That's not what we want. So with the Just Checking system, it just feels less invasive, and I quite like the equipment being very small with no wires.
To install, it's really easy. It is a simple case of sticking up a piece of Velcro and then putting a sensor in place, and the same with the door sensors. You put them in place, you switch on the main box, and then it's up and running straight away. It's very easy once you've had some training on accessing the charts. You can look at things in a number of ways to see what happens over, say, 7 days, or over one night, or over a specific hour. You can knuckle down right into people's care and the movement that's happening in a specific environment. Okay, so this is Wednesday night. We're looking at Wednesday night here on the chart. You can see the blue sensors, which are movement sensors. Most of this Wednesday night, there's some movement in this bedroom, or the bed in particular. What we've always tried to do, and will continue to do, is to look at how we spend money wisely. It's not necessarily about saving money, it's about using our money and our resources and the care hours that we commission appropriately in the right manner. And Just Checking enables us to do that and to make sure that we're accurately putting care in when it's needed.
We absolutely need to know if people need to be supported throughout the night. And this could be in the case of somebody's health, if they have complex healthcare needs, or if they are restless at night due to feeling not safe. So it's really important that we are able to monitor this so that we can give the correct support. So if that may mean that they need a waking night. But it may mean that they don't, and that's the good thing about it, is that it will clarify the right amount of support that that person will need.
This is really about providing the right social care support for our customers when they need it. And that's led to us being nominated for a national award for innovation in social care, which I'm really proud of.